You're on.
Alright, so today I'm going to be talking about honey and its uses in the medical world. So, just to kind of start off, this was from a previous presentation that I did, and I just wanted to clarify this part down here. I did some more digging and I found that in general, when you do like conversions for the dry medicine, that'll be like milligrams per tablet, which will be the concentration, but it can still vary depending on the dry medicine that
So
you have.
and then you're saying like this could be milligram of the drug per kilogram body weight, or no?
Yeah, so this
Okay.
is the weight, this is the dose, and
Okay.
this is the concentration.
Oh,
of
I
the
see,
medicine.
that the tablet has to be, okay.
Yeah.
Based on the body weight,
Yeah, and so
Okay.
you'll put all the conversions together to end up with tablets.
a certain pill size,
Mhm.
okay.
Yep. So then, basically, I wanted to kind of get the basis down of what honey actually is and kind of the different processes that it goes through in order to become what it is. So it starts out the nectar that the bee gets from the flower or from any other kind of plant that it is able to. And then it kind of goes to what is called like the bee's crop area, and at that point it'll interact with some enzymes that will kind of change the chemical composition and the pH in order to help like preserve it while it's out away from the hive. As soon as it returns to the hive, it will go from bee to bee to bee until it gets to the honeycomb area, in which then it will be deposited into that comb. And then the wings will be used as like a fan to actually help with the water evaporation, because at that point it's not that thick honey that everyone's used to seeing. And so then by that point it'll be thick, and then at the end it will be sealed by a secretion from the abdomen of the bee that is known as beeswax once it's dried. And then it'll be the food source for when the cold arrives and the bees can't necessarily go out like they normally do.
Okay, yeah, because this is probably a good review for everybody, because I don't know how this works. I do know that sometimes when you buy honey, and I've seen these hives out in the fields, sometimes they'll say alfalfa. Is it alfalfa honey? Is that how they label that? You know, it's like mainly from alfalfa.
I think it's clover.
Clover
Yeah.
is another, you know, alfalfa is a clover, but there's other clovers too, but clover honey, yeah, I mean, it's really rather interesting
Yeah,
how
and
this all
there's,
works. So they're doing it for their own food supply for the
Mhm.
winter, but then yet we take it in.
Mhm.
So then what do they do? Because I've seen trucks of bees, you know, and then they drop off the hives.
Mhm.
What do they do with the bees in the winter time then? Do you know? I'm curious.
I can't say for sure,
Okay.
but they probably have some sort of storage unit to keep them in a controlled temperature.
Right, and then they just use honey, they probably leave them some honey or something, yeah.
Mhm.
Very interesting. Okay.
Yep. But kind of something else I also picked up with this, and it kind of depends on where the bee most often frequents to go get the nectar, can actually change the like taste or some of the certain properties of the honey.
Mm-hmm.
So, characteristics of the honey, so it's actually, as far as the medical side of things, it's been used as wound dressing for like thousands of years. And there's two different bioactivities of, and physical properties of, that help kind of speed up the healing process. And one is acidity and the other one is its high osmolarity, which I will explain all of these in further slides. So then it also has antimicrobial and anti-inflammatory properties. I thought this was pretty cool because before my internship this summer, I just knew about the antimicrobial part. I didn't know about the anti-inflammatory part. So when I saw it being used in practice, I thought that was pretty cool. And then there's also two different kinds of the antibacterial activity that the honey has, which is hydrogen peroxide and Methylglyoxal. So,
Wow. And refresh my memory, where was this summer?
it was down in Texas.
And it was a bird.
The Abilene Zoo.
It was a what?
Oh, what?
Oh, at a zoo?
At a zoo.
Okay.
It was at a zoo. So
Okay.
I was mainly working with the wild bird rehabilitation.
Okay.
place. So, yeah. So starting off with the pH, with the low pH, it makes the protease activity less favored, which when protease is active, it will actually kind of destroy some of, oh, oops.
Okay.
There we go. It'll actually destroy the tissue matrix that is needed for the repair of that tissue. And so with the low pH, it actually prevents that from happening. And then the pH also promotes the healing by the increased release of oxygen from the hemoglobin.
That's circulating nearby.
Mhm.
Okay, wow.
Yes. And then, yeah, and oxygen, like one of the main reasons that's important is that it's required to help with other different processes that are gone through in the healing process.
So oxygen is needed.
Mhm.
Okay, now, does anybody know, like in a local hospital, how they would use oxygen for wound healing? There's usually a device they might have. Do you know what I'm talking about?
I think so. I think I read something
They
about
put them in like an oxygen chamber.
Yeah, what's that oxygen chamber called? Hyperbaric chamber. And then it's like famous for wound healing, but it's also used for carbon monoxide poisoning. You can either put a body part or the whole body in it. And it's high oxygen and it's very good. If somebody has a chronic wound that they can't heal, they'll often use a hyperbaric chamber. And was it somebody in this class talked about how they can use it for horses too? Was that this class? Somebody told me that someplace they have a hyperbaric chamber big enough that you walk a horse in. If it's got trouble with wound healing, must have been another class. That's kind of neat.
that. So next is the high osmolarity, which with that it draws the fluid out of the wound as well as the fluid out of the bacterial cells, which in turn will inhibit their growth and expansion, and it'll help decrease the infection.
And it draws the fluid from the tissue or the bacteria into the honey itself, right?
I believe something
that's right.
with that, yeah. And so in that, you're probably thinking it's going to dehydrate the tissue, which as long as there's a good circulation going through, hydration shouldn't be an issue. And so sugar has this similar effect, and there's actually studies done on, like sugar and helping with the wound healing process. But once it gets diluted to so much of a concentration, it actually becomes ineffective as compared to honey. So, but yeah, sugar is still used in some processes. So, yeah,
Mhm.
and these are just some of the different kind of examples that we gave.
Of different sugars they use.
Then with the antimicrobial and anti-inflammatory, so this slide has just the kind of the main antimicrobial properties, and then the next slide will have more anti-inflammatory. But the potency of the honey can actually vary greatly between the different kinds of honeys. So whether it's the clover honey or if it's honey from bees who frequent lavender, it can change some of the actual different properties. As well as, I can't remember if I wrote it on here, but I know it's coming up at some point, but with the minimum inhibitory concentration at around 11% for honey, it was actually even able to inhibit the growth of MRSA, as well as, the non-MRSA ones as well. But I thought that was pretty cool that it was able to do something even like that. Right here. There we go. Manuka honey. And I believe that applied to this situation as well. So with Manuka honey, at 40% concentration, it was actually shown to significantly reduce biofilms as well, which it is kind of really hard in general just to get rid of a biofilm with like just the regular immune system. And some other kinds of things. But Manuka honey is actually showed to be able to reduce that. And in studies at 50% concentration, it was actually able to kill the susceptible form and the resistant form, as well as this bacteria, respectively with these numbers. And they all have biofilms.
Okay, so now, biofilms would protect the organism, and if you could break it down so much better. Manuka, Manuka honey, is that a plant? I'm totally ignorant. What does that mean?
I believe, so I'm sorry, I'm trying to remember.
Yeah, sure.
I think it was from either a tree or it is maybe some kind of plant.
Okay, so it's some kind of plant, tree or other plant. So
Yeah.
that's Manuka honey, okay.
Yeah, but I thought it was interesting. 'cause I'm
Yeah,
not-
I bet you, because it depends on where the bees are going, and that plant would have unique characteristics, so the honey would have unique characteristics, because, you know, a lot of medicines have been discovered in plants
Mhm.
and trees, so it kind of makes sense.
Yeah. Yep. There we go. So the more of the anti-inflammatory properties, they actually did some studies with burns on pigs and rats and they made sure that the burns were sterile so that it wasn't just an anti-inflammatory in terms of getting rid of the infection, that it was an actual anti-inflammatory on its own, aside from the infection. And it actually proved to be true that it does have the anti-inflammatory properties on its own. So it has this in here. Well, the bee has it. This apalbumin 1, and it actually inhibits the phagocytosis of the macrophages. So then, if it's activated, then methylglyoxal found in the Manuka honey will become like a stronger inhibitor. So.
Okay, and so you're saying it's good to inhibit the macrophages for the wound healing? Is that what you're saying in this case?
Yeah.
Because, you know, they can do a lot of damage, and sometimes they do too much damage, so that's
Yeah.
maybe what you're referring to here.
Yes.
Okay.
Yeah. So lots of different properties.
Mm-hmm.
So then moving on to the hydrogen peroxide and the methylglyoxal. So with the hydrogen peroxide, it's like an interesting situation because when honey has that, it actually is quickly inactivated by the catalase that is in the blood and the serum and wound tissues, and so in the end it's actually not as effective as like how the Manuka honey has the methylglyoxal. It won't be inactivated by the catalase that is in the body.
Okay.
So it becomes, again, more effective. That's one thing I found in kind of the research of all of this, is that Manuka honey is probably the ideal honey to use.
The best one you
in
can
wound
find.
healing.
Oh, and then you see you've got trees there, so it is a tree.
Mm-hmm,
Okay.
yes.
See, we answered our own questions. There's a question back there.
Oh, no, I looked it up and it said
Oh.
that it's like a tree that's only found in New Zealand and Australia.
Okay.
Mhm.
So maybe it's like, I don't know.
But with
high
the
value.
way everything is shipped around, I bet you can go to a health store and find it. They're very interesting. Okay.
Mhm.
Nick, can you finish up in about a 1 minute or two?
Yes.
Okay.
Yes. So then, yeah. Yep. And so this is just kind of some bonus information
Wow.
that I thought was
We don't
really
have to
cool.
pay any more for this, then, you're saying?
Yeah. So this right here is just kind of short for the pain receptors, but when the inflammation is there, it makes those pain receptors more sensitive, and in turn, that will kind of react and kind of interact with the acidity of the honey. So the more quickly the acidity of the honey is introduced to the inflamed area, the more pain it'll actually cause. So if you have something like gels or something where the acidity will be released slowly from the honey,
Oh, I see. Okay.
there's actually going to be less pain in the end, because it's not just like
Mhm.
hitting right on with the inflammation and the acidity. And so to kind of avoid the pain, you can use, to avoid more pain, avoid using things like just plain honey,
Okay.
or just putting it on gauze and then sticking it right on.
Okay.
There's actually like tactical ways to go about applying it. And then this last part I thought was pretty cool as well, because there were studies done where there's wounds that would take like forever to try and heal, or maybe they wouldn't have even started healing, and as soon as honey was brought into the situation is what started the...
It promoted the whole process.
Mhm. Yeah.
Ready for some more questions then? I'll let you point.
So I guess I have few questions, follow up afterwards, but, so do you have any experience using honey with animals, things like that, as a, like a treatment?
Yes, over my internship this past summer, it was actually used on a couple different birds. One was actually the zoo's bird, and the other one was like a wild bird. Both had inflammation and like unwanted like wounds and everything. So the application of the honey, they actually had like a little pad, like compressed pad of honey that they used to like wrap around that and to help.
And place it right on the wound and then wrap it, and then so it would stay there.
Yeah, and there were actually significant signs of improvements.
That actually answered my second question, like how do you prevent the animal from licking it off?
Mhm.
Yeah.
Right, yeah.
Yeah, lots of wrapping
Yeah.
and that wrap and yep.
I mean, I think that's fascinating because it does have some neat properties.
Mm-hmm.
And like the sugar bandages too, or you put sugar on wounds and stuff like that. It's another subject. Other questions, comments? Okay. If not, Adrian, why don't you come up and do this? I guess I will shut this thing off. I'll let you find your, sorry.